Thank you for joining us for the Navigating Medicare's Quality Payment Program Advanced Alternative Payment Models tutorial, brought to you as part of the MACRA educational series from the Physicians Advocacy Institute and Healthspirian. I'm Ray Quintero, and today I'm joined by my colleague, Priya Lamba. The Physicians Advocacy Institute's mission is to seek broader understanding of the challenges facing physicians as well as your patients, and to educate policymakers about these challenges. The Board of Directors and management of the Physicians Advocacy Institute is listed on slide number 3. The board is made up of CEOs that are currently part of the state societies as well as previous CEOs. In addition to that, Healthspirian is a Washington, D.C. based consulting and legal services firm, and we're based at the intersection of public policy, business strategy, operations, and government affairs, helping navigate the complexities and challenges that are currently plaguing our payment and delivery system. The MACRA Education Series purpose is to provide materials as well as resources to provide a great context for the overview of concepts as well as requirements and an in-depth discussion of topics that are important as part of the MACRA series. The MACRA overview is going to be a foundational presentation that's available to you. In addition to that, we'll be providing follow-on products throughout early 2017, which include in-depth one-pagers, as well as monographs that are focused on additional topics such as the MIP scoring system. In addition to that, we'll be developing resources regarding what is available to you in your individual physician communities. There are a myriad of acronyms that are available as part of the MACRA program, specifically related to the QPP, which are all listed on slide number 6. These acronyms are meant to help guide you as you navigate your way through the Quality Payment Program and MACRA. In today's presentation, you will find MACRA at 30,000 feet. In addition to that, we'll discuss the payment adjustments and we'll go into depth on the advanced alternative payment models, specifically talking about APMs under the QPP, the criteria of those as well as other payer advanced APMs, APM entities' responsibility for risk, as well as participation in advanced APMs, and when physicians participating in APMs are exempt from MIPS, those participation thresholds, and which are available for you in 2017 and those that have already been proposed for 2018. And we'll conclude with a reporting timeline and next steps looking forward, as well as answer a few questions that are commonly asked related to the program. MACRA's QPP at 30,000 feet. MACRA is the Medicare Access and Chip Reauthorization Act, which was passed by Congress in 2015. It was meant to replace the sustainable growth rate and be the next phase of the Medicare fee-for-service system under Medicare Part B. And what was this new system intended to do and what should it do? Is it's developing the quality payment program in order to introduce new opportunities for positive as well as negative payment adjustments of your Medicare Part B payments. And in addition to that, it's intended to combine those quality reporting programs that you've been involved in over the years, including PQRS, the value-based modifier, and the meaningful use program, all into one in order to eliminate some of the administrative burden, in order to streamline those programs, and to help you better show the quality care that you are providing to your patients, as well as be rewarded for that. And in addition, they've also created a new category, which we will talk about in another one of our tutorials. Their regulations were finalized in November of 2016, and the final rule for MACRA went into effect on January 1st of 2017. And those payment changes as a result will begin in 2019, and they're based on your performance this year, which is 2017. What are the goals of the payment system? As we continue moving forward, they hope to improve patient outcomes and engage with patients, encourage physicians to improve performance with carrots as well as sticks, and increase the availability of participation in risk-based models of care, support your participation, including small and solo practices, and simplify complex and multiple reporting and performance systems, as was just mentioned. However, it's not going to be easy, and it's going to be a long road ahead, which this tutorial series is aimed to help you navigate. There are two pathways for physicians to choose from as part of the QPP. One is the merit-based incentive payment system, which is MIPS, and that is based on fee-for-service annual updates, which is a system that you're most used to based upon the past payment model under the sustainable growth rate. However, under this model or this pathway, there are a new set of positive as well as negative payment adjustments. And again, there are 4 performance categories, which are looking at cost, quality, improvement activities, as well as advancing care information. And in addition, under this pathway, you have the opportunity to participate in alternative payment models. These payment models under this pathway are specifically called MIPS, alternative payment models, not to be confused with advanced alternative payment models, which are under the other pathway. So speaking of the other pathway, advanced alternative payment models is the other pathway that you have to choose from. Under that pathway, you can benefit from enhanced fee-for-service annual updates. You can be exempt completely from MIPS participation, as those of your colleagues that are participating under the other pathway are required to be a participant in. As well, you have payment incentives for participation in risk-based payment models, and CMS has identified those eligible models, and we do expect additional models to evolve over the years through various processes that have been set up under the MACRA law. As part of participation in advanced alternative payment models, you have the opportunity to earn a 5% payment incentive each year, beginning in 2019 up until 2024. And beyond that, you may earn 0.75% in annual Medicare Part B physician fee schedule updates for successful participation in advanced APMs. And those who do not participate successfully in advanced APMs would receive a 0.25% annual update. The intent of MACRA, as well as the QPP, is to start moving you as physicians toward advanced alternative payment models. But there is an understanding that in the early years that it will not be possible for all physicians to participate in advanced APMs. So many of you will be participating in MIPS APMs or participating in the MIPS system rather than moving directly into advanced APMs. But today we'll be discussing advanced alternative payment models, and more detail can be found on the PAI website regarding the MIPS payment system. There are multiple adjustments that are available depending on the pathway that you select. As you can see on slide number 12, ranging from 2017 all the way up to 2027, there are annual fee updates that apply either to all physicians or to those participating in the MIPS program or those participating in advanced APMs, but specifically those that are qualifying participants under advanced APMs. As you can see, in 2017 to 2019, all physicians are eligible and receiving 0.5%. And in addition to that, for those participating in MIPS, in 2019 all the way up to 2027 can receive a positive or negative adjustment beginning at 4% in 2019, going all the way up to 9% in 2027. And in addition to that, there's also additional bonus payments available based on those that are the highest of performers. But again, those details are available in another one of our tutorials. And those that are participating in advanced APMs from 2019 to 2024 all receive that 5% bonus payment. And now I'll hand it over to my colleague Priya to talk a little bit more in depth about advanced alternative payment models.
Thanks, Ray. I just want to note one thing, that there is a 2-year gap between the performance year and the payment adjustment year. So the the graph that we're just looking at with the payment adjustments for the 2019 through 2024, those are based off of 2017 through 2022 performance and advanced alternative payment models to be eligible to receive that 5% incentive payment. So what are alternative payment models, or APMs as they're known? An APM is a payment and delivery approach where participants in the model have financial incentives to provide efficient and high quality care. Now these APMs can diverge from fee-for-service, but may also have some elements of fee-for-service built in as well. So what I mean by this is they may have bundled payments or shared savings and shared losses with some component of regular fee-for-service payments that you are currently familiar with, but this varies depending on the APM. APMs also include performance measurements, and they link payment to quality and outcomes. And the specific characteristics and the level of financial incentives that are linked to these quality and outcomes, and at which the participants are responsible for the cost of care for the population, vary again based off of APM. So there are many ways that these are being structured currently and going forward in the future. And they may apply to specific services for specific conditions, episodes of care, or patient populations. There may be some more generally applicable ones, but some may, as we will identify going forward, really focus in on more specific patient populations with a specific disease or treatment path. The primary care medical home models are often considered APMs, and APMs exist in the Medicare world as well as commercial and multi-payer spheres of healthcare. So they are across the board. You may be participating in one or more of these. So what are advanced APMs under the QPP? A good thing to remember is that APMs exist on their own, and advanced APMs are then a subset of those APMs that currently exist that meet the requirements laid out by the MACRA statute. Key thing to note here is that physicians participating in advanced APMs must meet the quality reporting requirements that are subject to participation in the APM itself. So the advanced APM criteria under the QPP do not dictate what exactly you are reporting in terms of quality, use of cert, et cetera, to that level of detail. That will still be in the APM model that you're participating in. Again, the characteristics and criteria of participation are defined in MACRA, but is to set a high bar for a model where participants are accountable for cost and quality. So MACRA just defines the general characteristics of the types of APMs that can be considered advanced APMs. Again, you may earn a 5% incentive payment, but these are only available for physicians who meet the qualifying participant thresholds, which we'll cover shortly, and physicians who are participating in advanced APMs and meet these thresholds will be exempt from participation in MIPS. Another key thing to note here is that your 5% incentive payment under the QPP is separate and distinct from the payments for services for which you receive through the APM. So there is a potential outcome where through the APM you may have decreased costs because of the risk sharing arrangement, but because you are participating in an advanced APM, may be able to offset that using the 5% incentive payment offered through the QPP. And physicians and their organizations called an APM entity decide whether to participate in an advanced APM. This is a key thing we will be getting back into in the next couple of slides. So what type of advanced APMs are available under the QPP? As we mentioned, there are APMs across the healthcare world in Medicare, Medicaid, and all payer and private payer arenas. So under the QPP, currently, the primary focus is on Medicare Advanced APMs, and CMS has identified several for 2017 and 2018. They are currently still adding to the proposed list for 2018. But beginning with the 2019 performance year, CMS will also be adding in non-Medicare other payer advanced APMs into the mix. So this category will potentially include APMs by private payers, by state Medicaid payment arrangements, and even possibly Medicare Advantage. The details of this are yet to be seen, so you'll be tracking this going forward. The criteria for Medicare and other payer advanced APMs. And the macro has laid out what the criteria need to be for APMs to be eligible for the QPP program. So for advanced APMs, these are Medicare advanced APMs on the left. The APM is a certain CMMI, shared savings program track, or a certain federal demonstration program. The APM requires its participants to use certified EHR technology, or CERT. The APM must base payments for services on quality measures comparable to those in MIPS. And the APM is a medical home model expanded under CMMI, or the APM requires participants to bear more than nominal financial risk for losses. Now, the other payer advanced APMs, these are the non-Medicare ones, which will begin in 2019. These criteria are very similar to the Medicare advanced APMs. Again, APMs must require participants to use certified EHR technology. They must base payments for services on quality measures comparable to those in the MIPS program. And they must require participants to bear either more than nominal financial risk for losses, or the APM is a Medicaid medical home model that meets the criteria comparable to medical home models. Now, advanced APM entities must be responsible for performance and risk. So one of the criteria was that the advanced APM must require participants to bear more than nominal financial risk for losses. And what this means is the APM must take on some risk to help ensure that participants have a vested interest in the costs and quality of care being provided. So this level of risk is taken at the APM entity level. To qualify under the QPP, the APM entity must take on payment risks for years when the APM entity's actual expenditures under the advanced APM exceed its expected expenditures. And the level of risk, again, must be more than nominal, and the more than nominal risk determination is based on total Medicare Parts A and B revenues or expenditures. A key thing to note here, again, at the bottom, the APM entity as a whole is responsible for taking on the risk. It's not each individual physician in the APM entity. The QPP establishes criteria for determining when an APM qualifies as an advanced APM. How the APM actually functions in relation to risk adjustment and related topics of calculated savings and losses is governed by the underlying APM's rules. So those level of details, you will need to look at the actual APM model that you're interested in to see if that is something that is feasible for you. And when we are talking about APM entities, these can be comprised of a combination or sole practitioner, but it's a separate entity that's participating in the APM model. So what is the financial risk standard for an APM? So when actual expenditures exceed expected expenditures, the APM must provide for one of the following consequences. It must either withhold payments, it must require the APM entity to owe payments to CMS, or alternately, it could reduce the payment rates to the APM entity or the APM entity's participating clinicians. So it must have one of these three options built into that, one or more of these three options built into it. And when they say more than nominal, what does that mean? So in order to ensure that a good level of risk is taken on for the QPP program for the advanced APM pathway, the APM entity must take on more than nominal risk, which must be at least equal to either 8% of the APM's entity's average estimated total Medicare Parts A and B revenues of the APM entity, or 3% of the APM entity's expected total Parts A and B expenditures for which the APM entity is responsible for under the advanced APM. Again, it doesn't have to be both of these, it just needs to be one of these. And the QPP requirement here, the macro requirement, is that it must be at least equal to 8% or 3%, but the actual APMs may have higher thresholds than these minimums. So what are the required elements for receiving an advanced APM incentive payment? So in order, you have we'll work away from the top bottom, you have an alternative payment model, and within that subset, you will have some that meet the criteria to be qualified as an advanced APM under the QPP. And then the participants in an advanced APM are APM entities, and these again are separate, distinct entities from the participating physicians who can be qualifying APM participants. So these are the ones that would receive the 5% incentive payment. I'll walk through each of these. APM entities and participation in advanced APM. So again, participation is determined at the APM entity level. It is not determined at the individual physician level. So if you're participating in an APM entity, it's the entire APM entity and all physicians will receive the same threshold and QP determination or PQ determination. An APM entity is a sole MIPS physician. It could be a solo practitioner. It can be an organization of physicians and other eligible clinicians with multiple tax identification and numbers or TINs. So this can be an organization of collaboration of other physicians. It could also be an organization of physicians and other eligible clinicians with APM identifiers and NPI TIN combinations in which only some are APM participants while others are not. An APM entity, what we're trying to get at here, is can be arranged in a various number of ways that meets the needs. So in our APM entity, physicians exempt from MIPS. So to be considered part of an APM entity and receive credit for the advanced APM participation, physicians must either be qualifying advanced APM participants, this is QPs, or partially qualifying advanced APM participants, which are PQs. QP and PQ determinations are made based off of two methods. You have the Medicare patient count method and then the Medicare payments method. So it's a difference between a QP and PQ. QPs have higher payment or patient count thresholds than PQs. QPs, again, are automatically exempt from MIPS and are eligible to receive a 5% incentive payment. Whereas on the other hand, PQs have the option to be exempt from MIPS or participate in MIPS, but they are not eligible to receive the 5% incentive payment as QPs are. So we summarize some of those points here. The thresholds, again, so the 25% Medicare payment threshold determines whether someone is a QP, or 20% of an APM entity's Medicare patients through an advanced APM are the QP thresholds. And then for the partially qualifying advanced APM participants, the PQ thresholds are 20% of the APM's entities Medicare payments are received through an advanced APM, or 10% of the advanced APM, or the entities Medicare patients are seen through an advanced APM. Again, participation thresholds are determined for each APM entity as a whole. An APM entity could comprise of, again, the sole physician, multiple physicians, or other clinicians that are the same or different TINs. So it's collectively meeting these requirements, these thresholds of 25%, 20% for QPs, or 20% and 10% for PQs. These are how the thresholds are calculated. So for the Medicare payment count method, you're looking at the percentage of Medicare Part B payments that are made to all eligible clinicians in the advanced APM entity for all beneficiaries attributed to the APM entity. And then that's divided by the aggregate of all Medicare Part B payments for the attributed beneficiaries, divided by the total Medicare Part B payments for all attribution eligible beneficiaries. The Medicare patient count method, here you're looking at the percentage of Medicare attribution eligible beneficiaries who are actually attributed to the advanced APM entity. Now, this is calculated by the number of unique beneficiaries who are attributed to the APM entity divided by the total number of attribution eligible beneficiaries. Again, there's some terms being thrown around here. Attribution refers to how the patients are identified with an APM entity according to the underlying APM's attribution rules. CMS will make 3 QPPQ determinations throughout the year. So you will not necessarily need to do these calculations on your own. What CMS will do is it will have 3 snapshots in time, and these have been identified as March 31st, June 30th, and August 31st. And at these times, CMS will look at the APM entity and see whether they have met either the QPPQ thresholds at aggregate level. And then the physicians who are on the APM entity's participant list will all receive the same designation that was determined for the APM entity. So for example, if at the March 31st snapshot in time, CMS looks at an APM entity and determines that it has met the qualifying participant or QP threshold through the Medicare patient count method, then all physicians on that APM entity's participant list as of March 31st will be designated as QPs, which means they will be eligible for the 5% incentive payment and will be exempt from participation in MIPS. And it's APM entities and physicians who meet the QP thresholds during any of these 3 review periods will be exempt from MIPS and receive the 5% incentive payment. So, this offers you a chance if the APM entity isn't able to meet the QP threshold on March 31st, it may meet that threshold on June 30th or again on August 31st. Only one is needed to meet the QP threshold, and whoever is on the participant list at that time will receive the designation. If an APM entity does not meet either the QP or PQ thresholds, then they will be subject to the MIPS APM scoring method. And if an APM only meets the PQ thresholds, then the APM entity can elect whether to be subject to MIPS using the APM scoring standard for MIPS APMs, which is covered in another tutorial in more detail, or they can just elect to be exempt and just not receive either the incentive payment, but then also just not have to participate in MIPS. How do we know what advanced APMs are available? So CMS has posted its list of advanced APMs for the 2017 performance period on its website. At intervals no less than annually, CMS will update this advanced APM list, and CMS will include a notice of whether a new APM is an advanced APM in the first public notice of the new APM. So CMS has been updating their list for the 2018 advanced APM options. The complete list of advanced APMs is available on CMS's Quality Payment Program website at the link provided there. So advanced APMs available in 2017, as you can see, there are several. You have CPC Plus, Comprehensive ESRD Care Model, which is CERN only the 2-sided risk arrangements. Next Generation ACO, Oncology Care Model, again, only the 2-sided risk arrangement. The Vermont Medicare ACO initiative as part of the Vermont All-Payer ACO model, and the Comprehensive Care for Joint Replacement model, that's Track 1 CERT. And the Medicare Shared Savings Program ACOs only Tracks 2 and 3 qualify as advanced APMs. The key thing to note here is that if you're in an APM that is only shared savings or upside, then it is not considered an advanced APM. You need to have some level of risk to be an advanced APM for 2017. This is a list of proposed advanced APMs for 2018 as of the moment. CMS is continually adding to this list. We'll now hand it over to Ray to cover the timeline.
Thank you, Priya. And this timeline provides some key dates that are going to be very important to you as physicians as you navigate through the QPP. As Priya mentioned, there are going to be 3 specific points in which CMS will review those that are participating. And those 3 dates are listed, which are again, March the 31st, June 30th, as well as August the 31st. And in addition to that, one note that is of course important is that performance period did begin on January 1st. And again, that's for your actual payment, which will begin on January of 2019, which is at the very end. And the additional dates that are included on here include details regarding reporting for MIPS. So for those of you that were participating in an advanced APM but may not, or thought you were participating in an advanced APM but may not have met the thresholds and didn't choose to participate in a MIPS APM, for example, there are some other key dates that are available here. So this is an important slide, number 30, as you, again, continue to navigate. Next steps and looking forward. Are you participating in an advanced APM? If you are, CMS is, again, making those 3 determinations, and they'll check these determinations to see if you've met the QPPQ thresholds and are exempt from MIPS. And if you are meeting those, again, you're exempt from MIPS. And if you meet the PQ thresholds, then the APM entity you're a part of could elect to participate in the MIPS APM option, as we mentioned earlier. So there are some options available to you. And should you select the advanced APM pathway, the steps you should go through as a physician are multiple, but first you should determine whether or not your practice qualifies for any of the approved advanced APM options for 2017. As Priya mentioned earlier, those are always available on the CMS QPP website, and we also listed them as part of this tutorial on slide number 28. And you also have to determine as part of that whether or not your practice can meet the APM participation requirements. And again, it's important to note that these are separate from the advanced APM criteria under the QPP. The second step is evaluating whether the practice will meet the necessary participation thresholds for QP and PQ. And stay alert for those QP-PQ determinations throughout 2017 to see if you've met the thresholds and are exempt from MIPS. If you meet the PQ but not the QP thresholds, determine if participating in MIPS under that MIPS APM option would position you to be eligible to earn that positive payment adjustment. And finally, number 3 is considering MIPS or MIPS APM options if the advanced APM option meeting those thresholds is not currently appropriate for you. So as you make your way down this decision-making process, you do have multiple options available to you, but you do have to pay close attention to what is available to you in your practice, because not all options will necessarily be available. If you are not participating in an advanced APM, first you should determine whether you're exempt from MIPS participation. If you are not, you should certainly choose your quality reporting pace for 2017 by reporting or by evaluating your practice readiness. And there are multiple ways in which you can do this, and there are multiple reporting paces available for 2017. And as you do that, you should determine if participating that minimum of 90 days and becoming eligible to receive a positive payment adjustment is feasible for your practice. And hopefully it will be feasible for your practice. And you should then select those best reporting mechanisms by evaluating the practice resources that are available to you. And as you look at those resources, which are available, again, in another one of the tutorials available on the PAI website, you should be considering whether or not certain factors apply. For example, whether or not it's specialty, diagnosis, or treatment-specific QCDR with more applicable measures are available. And if that's the case, that may make sense for you. And you should also ask questions such as if you have access to an EHR, because that also makes a difference. It does not make or break your participation, but it does make a difference in how you participate. And you should also consider whether the advanced APM option is feasible before making your final determination, because ultimately this QPP program is trying to, again, move physicians toward the advanced alternative payment model option. So if you can participate now, you are one step or many steps ahead of many of your colleagues. And as a recap of those resources available to you, which we mentioned a bit of earlier in this tutorial, these are also noticed on slide number 35. Again, there will be additional follow-on products, including those one-pagers and monographs throughout beginning of 2017, early this year. And we'll also be creating additional resources, a guide to those in your physician communities, as well as a continuously updated FAQ document that will be available on the PAI website that will answer important questions that are coming from the physician community. And you'll also be receiving regular email updates that will provide new information on those materials and tools that are available as provided by PAI and Healthsperian, in addition to those that are being provided by CMS as well as other organizations. And we have received a multitude of questions regarding the QPP and specifically advanced alternative payment models. We certainly don't have time to answer all of those questions, nor do we have an exhaustive list. However, again, the FAQ will continuously be updated, but we will take the opportunity to answer a few of those questions that have been posed at this point. So to begin, we will start with a few questions now. Priya?
The first question, is it too late to be an advanced APM for 2017? And what about 2018? So to be an advanced APM for 2017, the APM entities would have had to, for all the advanced APMs, either begun on January 1st, 2017, or already be approved for starting in 2017. So in that sense, unless you are already part of an APM entity, it is difficult to be part of an advanced APM for 2017. However, it is not too late for 2018. If this is a path that you are interested in and you are aware of advanced APM options that would suit your practice, and there are APM entities that you could either join or create a new APM entity in collaboration with other providers, you still have time for 2018. Just note that the specific application deadlines and RFAs or requests for applications for each APM that is considered an advanced APM varies based on the APM model. So you will just need to check the PAI website on that model's information or the CMMI website on the model's information and their application dates and deadlines and other requirements that need to be met in order to participate for 2018. Right? Would you like to take a second question? Anything else? Another question that we've received is, how do I participate in an advanced APM? I think we are trying to get at this throughout the webinar recording, is to note that you can't just directly just pick an APM and opt in to participate in that advanced APM. What needs to happen is you have to participate in an advanced APM through an APM entity, so a separate entity that is to participate in the advanced APM. So for example, in the Medicare Shared Savings Program tracks 2 and 3, the APM entity would be the ACO that you are participating through. In other models, it could be a practice that is participating through that model. For example, the CPC plus advanced APM is determined at the practice level. So the APM entity varies based off of what the model is, but you need to be in one of a designated designated APM entity to be participating through that model. Thank you.